Hello, good afternoon everyone and welcome to Libreng Consulta. I'm Dr. Ana York Bondoc. Thanks for joining us before lunch. And we have the weekend po. We're going to pick up your questions today and a few that were left po sa aming messenger. Please follow us on YouTube and Facebook. We also are now on TikTok po. And we do have an Instagram, though we are not as active on Instagram as we would like to be. So sa yung mga may tanong po, hindi po makakatulong sa inyo yung naglagay, pwede po bang magpakonsulta? Okay, that's not helpful. Ilagay nyo po kung ano po yung tanong ninyo and we will pick it up po during our live sessions. Okay? Kasi po, we can't do solo consults. There are just too many questions po and too many persons. Kaya lang po, ngayong we have 45 minutes, we will try our best po to give some enlightenment po and to talk about some interesting diseases na pwede gusto nyo pong maliwanagan about. So please put your questions below and Miss Reina and Miss Kat will pick them up and we will try our best. Again, I'd like to remind everybody na hindi po ito specific para sa inyo po yung sagot. Ano kasi hindi naman tayo nagkita. But hopefully, magkaroon po ng konting direction po yung inyong gagawin and maybe we can all learn something in the process. So thanks again for those who will be sending their questions. Meron na nga pong nagpadala and let's start po.
From Ms. Jean Tina Lakinon Manlangit. Hello po, Doc. Magandang umaga. Tanong ko lang po, ano po ba pwedeng inumin ng antibiotic para sa akin po? 33 years old po. Pabalik-balik po kasi ang ubo ko. May asthma din po kasi ako, Doc. Maraming salamat po sa pagbasa.
Okay. Thank you so much. This is a 33-year-old lady who is a diagnosed asthmatic. At least I hope you are a diagnosed asthmatic with repeated cough. Okay. Question number 1. May lagnat po ba ang inyong ubo? Question number 2. Kung may lagnat, then that's the time that we could consider an infection. Pero kung wala pong lagnat, and pabalik-balik po, we may consider two things, especially po if you are a diagnosed asthmatic. Number 1, hindi po kaya ba asthma in exacerbation po ito, no? Or this could be a manifestation po of your asthma itself. Frequent coughing po, lalo na't hindi nawawala, may be a sign of an allergy or an asthmatic reaction. Okay? Question number 2, baka po you're allergic to something. So, ang approach po dito is more of an allergy. Okay? And possibly allergic rhinitis kung tumutulo din po ang sipon nyo or anything else that's going on there. So, puntahan po natin si asthma. What is your medication for asthma? Is it well controlled? When did you last see po your pulmonologist? Are you taking inhalers? Are you taking inhaled steroids? So yun po yung mga dapat nyo pong pag-usapan at pag-isipan po ng inyong doktor. Okay? Number 2, if you think this is an allergy or a form of allergic rhinitis, you may consider po yung mga anti-allergy drugs. And number 3, hindi po ako mahilig magbigay ng antibiotics because antibiotics are used for infections. Okay? Infection. Most likely bacterial. In fact, antibiotics, as we understand them to be, or antivirals, antibacterials are not useful po for viral infections. So yun po yun. You need to assess why are you coughing. Kung infection po yun and it is determined to be bacterial, that's the time we'd give an antibiotic. Lalo na kung hindi naman po nag-clear up. But from your kwento po, it looks like more of an asthma manifestation. So, magpatingin po kayo. Okay? And lastly, do you keep any animals, cats, dogs, birds in the house? Ilabas nyo po. That is one of the causes of cough. Chronic cough, malaking problema po yan. I don't mean big, but it is common. That's what I meant po. Okay, next.
From Mr. Richard Sapinoso Serrano Andres, ano po ba ang valvular heart disease?
Maganda po ito. This is a very nice question. And can be, it can be, that's a whole conference po in itself, okay? First of all, bakit ho ba nagkakaroon ng valvular heart disease, okay? Let me just go with this. Ano po? Ang ganda po ng tanong na yan, okay? Okay, what is a valve? Bakit may valve sa puso? Anyone wants to pick up this question? Okay. Valves po are para silang nasa gitna po sila ng mga major vessels and they swing open in one direction and then close. Okay? So valves open and close po according to the heart cycle po that we are in. Pag bumubukas po sila, they allow filling, and then as the heart contracts po, they also stop backflow. Okay? Pag nakabukas po, no, during diastole, as the heart is filling, ang ganda, no? Ang malalalim. There's two cycles in the heart, systole and diastole. Okay? Systole, that's when the heart pumps out blood. Diastole po is when the heart fills up with blood. Okay? And our valves po, there is, the most popular one is the mitral valve po. We have also the aortic valve, we have pulmonic, ganun po yun. Nakabara po sila into our major vessels. They relax to allow filling, and then as there's systole, sumasara po sila para walang backflow. Okay? So parang one way, gumaganon po yan eh. Okay? So that is what, those are the functions of the valves in the heart. There are 4 chambers, right and left atrium, right and left ventricle, and there are 4 valves din po. At valvular heart disease po ay pag nagkakaproblema po, either damage or disease po yung ating mga valves sa ating puso. Okay, what's the most common form of valvular heart disease? Sa Pilipinas po, at nung unang panahon, the most common po is rheumatic heart disease. Ina-attack po yung valves it's actually a streptococcus pneumonia bacteria. So, nadadamage po yung heart, then you get rheumatic heart. Okay? In the US, the most common valvular heart disease is degenerative. Habang tumatanda po, the valves become either, hindi sila bumubukas ng mabuti, or nagba-backflow po sila, which is causing mitral valve prolapse. Ang ganda po nito, it's very interesting po, and different valves have different problems. So, atin pong 4 na main heart valves, the tricuspid valve, that's on the right side of the heart, the pulmonary valve between the right, as the heart, sige, puntahan natin, the heart comes from, the blood comes from the inferior po, pabalik po sa puso, okay? And then, it enters the right atrium, and then, after that, the right ventricle. So, between the right atrium and the right ventricle, meron po tayong tricuspid valve. And then, from the right ventricle, pupunta na po siya sa pulmonary, It goes to the pulmonary artery. Doon naman po yung pulmonic valve. Tapos, lalabas po siya onto the right side of the heart. And that is the, between the left atrium and the left ventricle, mitral valve, and yung palabas po, yun ang aortic valve. So, maganda po ito. Ang haba po nung kwento, there's a whole section of cardiology related to valves. Meron din pong surgery for valves, which is a surgical replacement po ng ating aortic valve and mitral valve, usually the most common. And then meron din pong rine-repair yung mga valves through may pinapasok po ng mga catheters, either binubuksan yung baradong valve or inaayos po. So, maganda po ito. This is a very interesting topic. And siguro po, as we go deeper into cardiology, let's invite a valve expert. So who works on the valvular heart disease? Usually cardiologists. Pag may infection po, infectious disease. At pag inaayos po, yung interventional cardiologist. And pwede rin pong pumasok ang cardiac surgeon. Okay? It's actually very common, pero hindi po masyadong napapag-usapan. Pero magandang usapin po ito. Wait, how do you check valves? How do you know that you have valvular heart disease? The most common way po to diagnose valvular heart disease is really the echo. Kasi nakikita po yung movement ng valves, gumaganon po siya sa echo. So the echo is one of the most na ginagamit po to check valvular heart disease. Okay? Ang ganda. I'm sorry I can't answer it in detail kasi ang dami pong valvular heart diseases. Pero maganda pong usapin po ito. Okay, that's it.
From Miss Araima, good day po, Doc. Tanong ko lang po kung pwede po bang magpa-vaccine ang asthmatic?
Um, Miss, ano pong pangalan nung nagtanong?
Araima.
Arema, yes. Pwede pong bakunahan ng yung may asthma. Ang ano lang po natin, sana control po yung asthma nyo. Kasi kung hinihika kayo mismo dun sa vaccination site, pauuwiin po kayo. So, try to keep your asthma under control. Use your inhalers po at yung gamot nyo. And if you feel well, then have yourself vaccinated. Ngayon, kung talaga sumusumpong po yung asthma nyo at hinihingal kayo on the spot, then you need po to see your pulmonologist or your doctor para po ma-adjust yung gamot nyo para po kayo po ay mabakunahan. Okay?
From Miss Mayet Sebastian de Guia, hello po, Doktora. Ask ko lang po kung anong gamot pwede sa nagbubuntis na may
Ma'am, I think this is a more specialized question kasi po I don't know whether hyperthyroid po kayo o hypothyroid. Ano? My best advice to you po, number one, see your gynecologist. Number two, ang doctor po who will adjust your thyroid medications is called an endocrinologist. And number three, ma'am, magpabakuna kayo. Buntis na bakunado, pati si baby po ay protektado. Okay? I cannot answer, I don't know whether you're hyperthyroid, hypothyroid, or ano po, no? But sa bawat ano po, kondisyon, may kaukulang gamot po yon, and it is checked po via a blood test.
From Miss Jola Buko, hello. Hello po, Doc. Magandang umaga. Pwede magtanong, anong antibiotic po ang pwede kong inumin? Kasi yung ngipin ko sobrang sakit, abot sa ulo talaga ang sakit. Tagal na nito na nung nagpa-vaccine ako ng first dose. Nung December 2 hanggang ngayon, nagpapadede ako ng bata, Doc, 7 months pa lang.
There's a bunch of information po dito na hindi related. Ano ba masakit?
Ang kanyang ngipin daw po.
Okay. Okay. Ang daming daming details. Sige, himayin po natin. Number one, kung masakit po yung ngipin nyo, the first thing that you need to do is see a dentist. Hindi po kayo magse-self-medicate ng antibiotics. Kung namamagana po yan, it could become an abscess. Kumbaga, baka magnana po yung ngipin nyo and you need to see a dentist. Okay? Dentista po ang sagot nito. Okay, number two, ano yung relationship po ng ngipin nyo sa vaccine? Wala pong relasyon yung sakit po ng ngipin nyo regarding your vaccine, okay? So it's not related. And number three, okay naman pong magpa-dentista kahit po kayo po ay nagpapadede ng bata. And you can tell po, if you're going to be getting a lot of antibiotics due to your, like example, bubunutin, then bibigyan kayo ng antibiotic, banggitin niyo po sa pediatrician po ng anak nyo and to the dentist po na kayo po ay nagpapadede po ng bata. Ma'am, pa-dentist na po kayo, wag niyo pong tiisin yan at baka po maging mas malalang infection pa po. That is called po an abscess. So, ayaw po nating magnana, masakit yon. Okay? Go to the dentist na po. Thanks, ma'am. And it's very good po na bakunado po kayo because you are protecting yourself and your baby. Good job.
From Miss Sham Chelsea, hi po, Doc. Good morning. May pumipitik po sa may likod ng ulo ko pero hindi naman po sunod-sunod. Nagkaroon na rin po ako ng back headache pain sa leeg pataas po. Ano po kayong pwedeng igamot? Thank you po.
Ma'am, you can try po over-the-counter paracetamol. But again, if you are, halimbawa, mga 2 weeks na or nagtatagal na rin po o pabalik-balik na po, hindi po maganda yung long-term use po ng painkillers and it is time to see a neurologist. Since you're mentioning batok, always check po blood pressure. Lalo na kung sumasakit ang likod ng ulo o batok po, one of the first is really blood pressure. Okay? So you may try po some paracetamol, but again, after a few days or talagang paulit-ulit or sobrang grabe po, you need to see a doctor. Okay? And check your BP.
From Miss Lydia Porlas, good evening po, Doc. Ano po ba ang gamot ng may sakit sa baga? Kasi ni-refer kami dito para sa sa sakit ng mama ko, especially sa baga or pulmonary?
Ma'am Lydia, hindi ko po alam kung ano po talaga yung Reyna, what is the meaning of sakit sa baga? Anong sakit yon?
Madami pong sakit sa baga, doktora.
Well, that's a correct answer. So, ma'am, you know what, when people, sa Filipino, I'm just speaking in context. When people say sakit sa baga, lalo na po yung hindi malinaw kung ano, most likely po TB po ang kanilang pinag-uusapan. I'm not giving TB to your mommy, ha? Sinasabi ko lang po, when people usually say, lalo na po mga Pilipino, sinasabi po sakit sa baga, pero walang malinaw, most often they are talking of TB. So Ma'am Lydia, please let us know po kung ano po ba talaga yung sakit sa baga po ng mami nyo, and then maybe we can give you some informations po, no? Kung sakaling TB lang po, no? Again, as I always say, TB po ay laganap po sa Pilipinas. It's really, really very common, and it is actually spreading, if I may say so, faster than COVID. Ang dami po talagang may TB, okay? That is why we require po a pre-employment X-ray for any job, actually, even the job of a call center, restaurant worker, waiter, teacher, nurse, doctor, even students po before they go to school, messengers, marami pong nagpapa-chest X-ray ng kanilang yaya and driver kasi po talagang lagana po ang TB sa Pilipinas. And if you have an abnormal chest X-ray, then you have to take 6 months of medication before you are allowed to go to work. So, Miss Lydia, please let us know po kung ano po talaga yung sakit sa baga po ng mother niyo. Okay? If it is TB, then we, as I already said po, no, kailangan pong i-check kung ano pong gamot ang dapat i-gamot sa mga pasyenteng may TB. Kasi laganap na rin, I'm sorry to say, laganap na rin po ang Pilipinas sa multiply drug-resistant TB. At hindi lang po, dati kasi as long as you do the 3-drug therapy, possible 4-drug therapy, tapos na po yung problema. But in this day and age, marami na rin pong TB na hindi na po tinatablan ng standard. So that's why we need to check. Okay? Sorry, I couldn't give a more specific answer. Pasensya na po.
From Mr. Benji Cercado Magaling. Dok, ano po bang magandang gamot sa pamamanhid ng kamay o mga daliri sa kamay? Salamat po.
Mr. Benji, offhand, two issues come to mind. Yung pamamanhid po ng kamay. My question to you, are you diabetic? Okay. Why did I ask that question? Kasi po, one of the most frequent complications, the term is complications of diabetes po, ay tinatawag nating peripheral nerve involvement. So, sometimes, what is the meaning of peripheral? Sa dulo, kamay at paa, okay? Sometimes it's not even sa dulo. There can be nerve involvement in the mid, like shooting pain po sa chan, down the legs, ganun po. But very frequently po, fingers and toes, okay? Sometimes parang tumutusok, sometimes mainit, sometimes malamig, sometimes, ang dami po, no? Daming manifestations. Ang solusyon po noon is to find out if you're diabetic, and the most important is to control your blood sugar. Some people will give vitamin B1, B6, and B12 or B complex. Okay? But the most better solution po doon ay ayusin po yung inyong asukal. Ngayon na you mentioned naman sa kamay, kung hindi talaga kayo diabetic, kuminsan po may mga naiipit na ugat sa leeg. So, try to look at that also. Okay? But the most important, pa-check up po kayo.
From Mr. Erwin, good PM po, Doktora. Ask ko lang po bakit madalas yung pag-ihi ko, tapos konti lang din ang lumalabas na ihi. Salamat po.
Sir Erwin, I'm assuming you're a guy, okay? And I don't know po what age you are. Pero as people, and di ba, one of our favorite guests is Dr. Dodge. Habang tumatanda po yung mga tao, they develop problems po sa prostate. Yun po yung mga hindi po makaihi ng parang may naiiwan, weird feelings about pag-ihi. Sir Erwin, pa-check po kayo sa urologist, okay? Another issue po sa pag-ihi also is diabetics. Diabetics tend to urinate very frequently, lalo na po when their blood sugar is not controlled. So, Sir Erwin, check your blood sugar and go to a urologist, okay?
From Miss
And thirdly, check also kung may UTI. Pero ang UTI sa lalaki, more than 2 times po, urologist rin ang punta.
From Miss Dina Gonzaga, good day po, Doc. Pag nabibigla po ako at sad at nag-iisip, bumibigat ang ulo ko at yung mga ugat sa gilid ng head ko, lumalaki. Tapos yung mata ko pumipitik-pitik. Left side, connected sa may leeg, Norgesic Forte po. Ang binigay ng doktor ko if needed lang. Salamat po, Doc.
Salamat din po. What is the question? Opo, hindi ko na-gets. Miss Rains, please explain the question to me.
Parang ina-explain niya lang, doktora, na pag nabibigla daw po siya at nag-iisip, bumibigat daw yung ulo niya at yung mga ugat niya. Actually, hindi ko rin na-pick up yung question, but I picked up her situation. Yun po.
Is this a stress-related issue?
Mukha po, doktora. Kasi,
Yeah. Alam mo, tama. As you the more po masyado tayong nag-iisip, the mind is connected to the body and the body is connected to the mind. Stress can cause many illnesses po talaga. My best advice sa mga people who are suffering stress-related illnesses, and I would like to say this also sa mga doktor, do not assume that all sakit, especially weird sakit or weird patients, at meron talaga, I don't mean to call anyone weird, but sometimes meron din pong mga kakaiba po ang attitudes, ang dating, medyo kakaiba. It doesn't mean na stress-related ka agad, even no matter how weird a person looks, okay? We are still obligated po to check up kung meron pa pong ibang rason. And of course, sabay po yung stress counseling doon. Okay? Kasi sometimes we are doing a disservice to people if we tell them, ay, stress yan. Okay? Importante po talaga na galangin po natin yung kanilang pong reklamo. Why did they go to the clinic? Give them a full physical check-up, family history, lahat ng gamot, alamin po. And pag talagang na-eliminate na po, of course, you can also explore yung mga stress issues po and personal issues sa buhay. And what I would say is sabay po natin yung gampanan. One is not more important than the other. And sometimes, eto na lang, syempre, doktor lang, doktor ay tao lang. So sometimes yung first impression, kung weird yung tao, ay naku, weird yan, stress. Hindi po ganon. We have to clear our mind of biases and approach each case po with the respect po that it demands. Okay? So, advice ko po sa inyo, have yourself checked up well and of course, reduce rin po yung stress sa buhay nyo. Madali lang kung sabihin, reduce yung stress, but it is very difficult to do. But again, kailangan po maging conscious din po tayo na stress and tension can cause diseases po sa tao.
From Miss Pam Chelsea, 30 years old po, naresetahan po ako ng Norgesic Forte 50. Siya tayong nagtanong regarding sa...
sige po.
Naresetahan po siya ng Norgesic Forte 50 over 650 milligrams. Hindi ko po malunok ng buo. Pwede po bang i-dissolve sa water para po mainom po?
Ma'am, I'm not a fan of Norgesic and I have never used it, okay? Hindi ko po siya ginagamit. My best advice to you is to go back to the doctor po who gave Norgesic and find out po kung bakit po yun binigay sa inyo and what is the proper way to use it.
From Miss Evangeline Alfonso, good AM po, Dr. Ana. Pareho po tayo ng vaccine, Sinovac at booster ay Pfizer. Mabigat at makirot sa braso. 2 to 3 days lang naman po ngayon. Okay na. God bless po.
Ay, Ma'am Evangeline, we had the same experience. Definitely po, there were less side effects with Sinovac. So my best advice, kung natatakot kayo sa side effects, do go for Sinovac. It's a good vaccine.
Okay, from Mr. Richard Sapinoso Serrano Andres. Follow-up question po, ano pong gamot sa valvular disease?
Sir Richard, there are so many kinds of valvular heart diseases po, no? Rheumatic heart disease, degenerative heart disease, meron pong mitral valve prolapse, meron pong mitral valve stenosis. Some of them, as I mentioned to you po, no, some of them will require surgical intervention. Meron din pong there's also acute valvular heart disease from infection. Those can be emergencies. So I cannot answer that po until I know exactly what is the valvular heart disease po na atin pong pinag-uusapan. As I mentioned to you, meron pong infectious disease doctor, meron pong cardiologist, pwede pa hong surgery ang solution po dyan. And I sent a young person po to surgery about 4 or 5 years ago po. She had a sudden infection po and developed po infections of her mitral valve. So, ang sagot po noon is emergent surgery. Her parents, one of whom is a general, was even afraid to send her. Bar exam po dapat ang hinaharap po nitong batang ito. She could not take the bar exam, or she was a young lawyer, soon to be lawyer. Pero talagang kinausap ko po and I said that we need to have heart surgery dito. Si daddy po, of course, very fearful, very shocked that their daughter had developed this disease. Pero sabi ko, baka mag-heart failure pa po yung bata and needs immediate surgery. And you know what? I met her tita 2 years ago. She's now a lawyer. So, sir, I cannot answer you what is the treatment for the valvular heart disease because I do not know specifically kung ano pong valvular heart disease po ang inyong tinatanong. So, pasyensya na po. Iba rin ho yung treatment depending on which valve po ang involved.
From Mr. Vince Flores, go Ninang.
Woohoo! Vice Mayor Vince Flores po ng Makabebe. Kasama ko po yan dun sa Kagawad Christmas party. Diyos ko, nagwala kami. Ang saya.
From Ms. Jeneline Zanoria Labasano. Hello, pwede po bang magpa-vaccine ng may sakit sa puso?
Ma'am Jeneline, yes. Hindi lang po pwede, pero dapat. Because sakit sa puso alone is serious. Tapos, halimbawa, ma-COVID pa yon, baka bumigay po ang puso ng taong yon. So, if you are worried or scared, pa-check up po kayo sa cardiologist nyo and proceed na po to the vaccine after.
Okay. From Ms. Rosemary Sonto, Doc, ano pong symptoms ng pulmonary tuberculosis? Bakit po kaya ako hinihingal pag nabubusog at nagbubuhat ng mga? Hindi po ba masama everyday mag-take ng Nebule?
Ma'am, do you have pulmonary tuberculosis? Kasi I cannot answer po kung hinihingal kayo or iklaro nyo lang po muna yung yung tanong nyo po, no? I can't understand why sandali, Rina, anong pagkaintindi mo doon sa tanong?
Parang siguro hindi niya po alam.
Sandali, are you worried dahil hinihingal po kayo and maybe you have TB? Ganun ba yung tanong?
Yes, para pong ganun.
Okay, sige. Sorry, pasyensya na po. I will approach that on that Natatakot po kayo because hinihingal po kayo that you might have TB. Okay? Ang shortness of breath po talaga or paghihingal, there are two main possibilities po doon. One is cardiac disease and the other one po is pulmonary disease. Okay? So usually, nire-refer po yan sa akin, especially when I was taking my fellowship, after na-clear po ng cardiologist. Sasabihin po sa akin ng cardiologist, Doktora or Ana, the heart is normal. Galing ako ng US noon the heart is normal, but the patient remains short of breath and dyspneic. So, can you give us a pulmonary workup, please? So, ganon. Complete with accent pa yun, So, basically, kung hinihingal po kayo and you're having a hard time po breathing, the first thing that you should clear po is the condition of your heart. Barado po ba puso nyo? Are you having abnormal rhythm? Malaki po ba yung puso nyo? Are you having valvular heart disease? Isa pa yan, So usually that is cleared up by an EKG and an echocardiogram. Kung nakikita po nila na you are high risk po for other cardiac diseases, especially po yung mga nababara po yung puso, then they will move towards further exams po dyan. Stress testing at umaabot pa hanggang angiogram. Okay? So once your heart is cleared, then we go to the lungs. What are the reasons po na short of breath? Meron ho ba kayong asthma? Do you smoke? may infection ba kayo? The first way to start is usually po a chest x-ray. Kung may TB po kayo, lalabas po yan 99.9% po sa x-ray unless maliit na maliit po. So, ganun po yun. Ano? We usually start po with a chest x-ray, review the symptoms, and move on from there. Causes po, symptoms po of TB, no? Classic symptoms. Number 1 po, pumapayat. Number 2, dumudura ng dugo. And then, number 3 po, when we look at the chest x-ray, talagang either may puti, may tubig, ganun po, no? But there will be many findings on chest x-ray. So the most important, ma'am, that you could start with siguro is EKG and chest x-ray. And let us move on from there. It is not bad po to take nebules every day if you are asthmatic. Kasi po yun po talaga yung treatment po ng asthma. Okay? If you are not asthmatic naman po at wala po kayong sakit sa baga, then you should not be taking any form of nebule at all. So, ma'am, parang may pool mo kayo kasi meron po kayong nebules. Pabalik po kayo doon pa check up. Okay?
From Miss Eugenia Balinton, Kabungkal. Doc, bakit parang may nginig po ako sa lalamunan? May maintenance po ako sa hypertension, 55 years old po.
Bakit po? Ay, sorry. I was just reading a message. Ano po yun? Pakiulit lang po. Pasyensya na po.
From Miss Eugenia Balinton, Kabungkal. Doc, bakit parang may nginig po ako sa lalamunan. May maintenance po ako sa hypertension, 55 years old.
Ma'am, this is our second to the last question. Ma'am, hindi ko mag-gets yung nanginginig sa lalamunan. Reina, can you please give me insights on this?
This is the first time also, Doc, that I've heard of this po.
Oo, ma'am, pasyensya na po. I am a doctor with many years of experience and Reina is also a nurse. Hindi pa ho namin narinig po talaga yung nanginginig sa lalamunan. My best advice po sa inyo, since you're taking naman po gamot for hypertension, number 1, check po yung BP. Okay? And then number 2, kung talagang hindi po nawawala ito, then maybe a good thing to do would be to go back po dun sa doktor po na nagbigay ng gamot and then pag-usapan niyo po kung ano pong nararamdaman nila. You are welcome po to send some details about po yung nanginginig and we'll be happy po to expound on that. Pasyensya na po, but this is really one of the first times that I have heard this. I'm sorry. Ikaw, Reina, any thoughts?
Doc, this is also the first time. Mahirap magbigay kapag hindi po masyadong concrete yung or detalyado yung nararamdaman niyo po. Paano po ba yung nginig? Parang may nanginginig or palpitate. Yun po yung pahabol niya.
Opo, yes. Ma'am, it's not a common complaint. Yun naman po ang masasabi ko. Medyo kakaiba po siya. Best advice, balikan po si Doc. Okay?
Yes, agree po. Last question will be from Ms. Roslyn Anisete. Good eve po. Ask ko lang po, Doc, about sa friend ko na hindi makalunok or laging nabubulunan. Nagpa-check up na po siya paulit-ulit. Ang findings, acid lang daw. Ano po kaya yung sakit niya? Sobrang payat na po kasi niya.
Parang I heard this question already. Ano po? I think I answered this and I don't want to scare anyone. But see po a good gastroenterologist and then maybe po they will check po yung by endoscopy po yung inyong esophagus. Lalo na po when losing a lot of weight, cancer is always a first consideration po. Not related to to nahihirapan siyang lumunok. Whenever I hear losing a lot of weight from a person po na hindi nagda-diet, a few things come to mind. Number 1, cancer. Number 2, using drugs, tumitira. Hindi po ako, this is not against any person na personal. Sinabi ni Doc, tumitira ako. Hindi po ganon. But I do often think about that if someone loses a lot of weight. And number 3 po, hyperthyroid. And number 4 po, TB. So check up those 4 issues if someone is losing a lot of weight. Yung nahirapan pong lumunok, again, maybe endoscopy, a gastroenterologist might be a big help po for you. Okay? So, pasensya na po. Again, these questions are not specific to you. I always end po with the best thing to do is to consult your doctor. I'm just giving you po some thoughts and some direction po on the way to go. So, sa inyo po lahat, have a happy weekend. And kung natawag na po kayo for your bakuna, please go. Maraming salamat po.